I thought I'll ask a question first of all. Have you ever taken any medicine for any reason? So let's say for physical health purpose, like say for example a headache or something even more serious. Do you know of someone or have you ever taken any medication for mental health? What about medication for the soul or medicine for the soul? It seems like this is fascinating, but the term psychiatry, what it means is it's medical treatment for the soul. Hi, welcome to my live, and this is Rani here. I'm a psychiatrist and I'm also a wellbeing coach. And for the first time, I'm going live both on Instagram and Facebook. But I thought this would be a fascinating topic to talk about medicine for the soul. And it's interesting, we don't talk about soul at all in mental health. And when it comes to treatment in mental health, we talk about biopsychosocial, which is bio means medication in terms of psychotropic drugs. We talk about talk therapy, as in CBT or other psychodynamic or cognitive analytical, for example. And we talk about psychosocial measures as part of the intervention. But we don't talk about soul. We surely don't talk about medicine for the soul. But again, if you think about it, it's quite odd, isn't it? How can we have any medical treatment for the soul? Because soul is formless. We don't talk about soul. We do mention it when we know someone, our loved ones or someone else's loved ones has passed away, and we say things like, may the soul rest in peace. And so one of the things I've always contemplated is, but where is the soul when we are alive? So that's something I'll ask you to just contemplate, because we don't talk about that. But in terms of medicine for the soul, two things come to mind, and I would like to share about my views about those. One is about prayer, and one is about love. I went to a conference, an interesting conference around personal recovery in mental health. I was really into personal recovery and helping my patients, not just clinical recovery, but also recovering despite their illness. So I went to this conference with a few colleagues of mine. This was several years ago. And I heard one speaker after another talk about empowerment, talk about a sense of hope and so on. But I kept wanting to hear about love, but no one even mentioned love or the feeling of love or anything like that. Maybe it's considered very wishy-washy. So during break, I checked with my colleagues. I said, listen, I really want to check with you. How come people are talking about all these good things, good stuff, but how come no one has mentioned love? And I remember this female colleague of mine, and she said, that's a good question, Rani. I think because no one has got the answer. What she said then stayed with me, because maybe that's why we don't even mention it. And maybe love has become too wishy-washy, or maybe when we think of love, we think about conditional love. But what about, we do talk about compassion, right? And I guess there's something about compassion that if love doesn't sit right for us, maybe compassion and kindness sits more comfortably with us. And only last week we had this mental health awareness week, and the whole theme was about kindness. And kindness, along with kindness, we can consider compassion and love. And also, I'm sure some of you at least have heard of this, that there was a wise physician, and he said the best medicine for humans is love. And then someone asked him, what if it doesn't work? And all he did was smile and say, increase the dose. And again, that strikes a chord with me, because how often do we, is it possible for us to just have compassion and kindness despite our judgment, despite us thinking, surely this person should get better by now, or surely love means this. And we always have some sort of conditions attached to a meaning of love. And what if the love that's the true medicine for the soul is unconditional love? The second thing we don't talk about is prayer. People praying. Have you ever asked for help And I'm sure you'll say, yes, I have asked for help. And most of, I'm not talking about help for like, can you get me a drink or can you pass me something else? But what if we are struggling and asking for help and it doesn't come easy for us? So it seems like when it comes to asking for help, people have reservations. But I remember, even as a child, although I was not praying to any God, maybe I was. I'll tell you that funny story. We all have prayed, pray like, oh, hopefully I'll pass this exam, or hopefully it won't be that bad. That sort of praying. It's like requesting a favor, but not really knowing whether who's going to return a favor. And so as a child, I still remember I prayed for personal gain. So to get something, like I hope I get a good gift on my birthday, or when I was in medical school, I pray, and I'm from India. Obviously, you might have got it already from my name and my accent. When I was in medical school, I used to pray for good grades. Like, oh, I hope I get some good grades. So there was always this sort of something about success, something about possession, that sort of prayer. And I also remember when I went through some certain life challenges, I prayed. And I'm not even religious, but I just prayed in my mind that things would get better, things would be okay. And it's really funny because although people might say, but I'm an atheist, I don't believe in prayer, I don't believe in God. And I'm not talking about if a God as in form or form that we need to pray to. But I'm wondering whether sort of prayer also has got a bad reputation because people associate prayer to religion. And people say, oh, I don't want to go there. And surely in mental health, we are not going to talk about any religion or sort of praying to a God. But how it seems to me is that when we are really struggling and suffering, and we are just fed up of the turmoil inside our head and the constant thoughts that seems to be coming to our head and so on, sometimes it just makes sense, even in the sort of depth of the suffering, to just get quiet and just putting our hands up and saying, I haven't got an answer. I just don't know what to do. And the prayer I'm referring to is just in a way surrendering. I mean, I don't know what to do. And just in that surrendering, not trying to fix a problem, not trying to find a solution, but sort of in a way saying, help me. And we might say that in sort of quietly, or we might say out loud. But I have, during my consultations with people, and the people I look after, especially in the National Health Service, some of them are going through extreme challenges, and I know that people might not see that as a prayer, but then when they talk about feeling calm, or despite everything that's going on, they are talking about a sense of just being present, and so. And I know some people are just saying that I'm just praying even more, and they don't even have a faith, but they don't know who they're praying to or what they're praying to, but they're just saying that they are just wishing things will be better. So in a way, they are perhaps asking the universe to support them, to help them. It's hard to put in words, isn't it? But what if what we talk about prayer and what might have a stigma attached to it, like, oh, only people who are religious pray, or only people who are wishy-washy talk about love? What if that's the medicine for the psyche or for the soul? And I'm not sure whether the soul needs any medicine or not, but I'm just using the term from where psychiatry was coined in the firstly, and how if psychiatry was initially, the term psychiatry was coined to mean medical treatment for the soul, and we know that actually how can you even give medicine for the soul, right? You can't give potions or tablets or injections or anything like that. So it's just, I'm just playing with words, but I really want us to reflect on the power of quiet, the power of stillness, the power of looking inwards, not looking for an answer as such and thinking if I turn inwards or if I just sit down and pray to whatever or whoever that I'll get an answer, but just doing that, so that knowing that whatever storm we are going through in terms of the contamination inside the mind, or the sort of excessive thoughts that seems to be overwhelming us, or excessive feelings or flashbacks or whatever person's experiences, knowing that when you are just acknowledging that's going on, but are just sort of doing your best, and you're just sitting quietly, maybe sort of in that sitting of quietness, you get a sense of you're being supported, a sense of deeply, I'm okay. And I think there's a lot of noise, by the way, not just externally going on around us, but also internal noise. But if we just pause to listen beyond the noise, beyond the quiet, or beyond the noise, beyond all the sort of mental activities, we do get a sense of this quiet. And I think that really is the medicine for the soul. So that's what I wanted to talk to you about really in this live. And do let me know your thoughts. Do leave some comments, any questions. But this one, I wanted to share this. I don't know how it's going to land on you. I'm not saying this is the best way to communicate what I'm trying to communicate, but here, this is how it came out. And I hope you have taken something of value or something to reflect on, because truly, I know medicine can only do so much for people. It might help when people are acutely unwell or acutely distressed, but it can't be a long-term fix. For the long-term fix, we really need to look at something deeper, something you can say we need to look for medicine for the soul. So thank you very much for watching. If you like what I said, do consider subscribing to our email and also listening to our podcast. Suraj, my other half, who's also a psychiatrist and wellbeing coach, and I have this podcast called Listening into Wellbeing, and we are sharing our ideas, sharing our understanding, working with people from all walks of life, with all sorts of mental health turmoil and stress and anxiety, and we are doing our best to give people hope and to point them to something that might be meaningful for them. And so that's it. And if you're checking on Facebook, do leave a message on, or leave a comment on Facebook. If you're watching on Instagram, do again leave a comment there so that I know it's been of any value or not. So thank you for watching. Bye for now.